Hi, it's Tom here from Running Physio. Today I want to talk to you a bit about muscle activation. And that is one of those terms you need to put the little quotation marks around because it's talked about quite a bit, and I think it's often misunderstood and misused. And actually there can be negative consequences of telling everyone that they need to be activating certain muscles at certain times. So we're going to dive into that in this video, talk about this idea of activation and whether you need to do that during particular tasks. I've also put a link there to our selection of different webinars. We've got a great one there on lower back pain in athletes. Do go and check that out. Loads of good information about assessment and treatment of lower back pain in athletes, which is often overlooked. Now let's start by being clear about what I mean by this activation. What I'm talking about is this trend to tell people to try and activate certain muscles during functional tasks. So let's give you an example. I was looking after a patient recently who was told that he wasn't activating the right muscles when he was walking. So he was told he needed to try and activate his glutes more, his hip flexors less, etc., etc., etc. He had this long list of different things he needed to do. Now, there was a major downside of this. It took a movement, walking, which is something we do without much thought, and made it this complex, difficult task that he suddenly didn't feel he was able to do correctly. Now, actually what that meant is that when he was walking, he was tensing up, becoming tight, he wasn't relaxed, and he reached a point where he was only really able to walk about 5 minutes before he had a lot of pain, a lot of muscle tension, and he had to stop. Now, in this situation, probably the most helpful thing we did with this gentleman was to say, okay, don't do that. Just walk. Don't think about it. Don't consciously try and activate these muscles. The muscles will do the work for you. You don't need to tell them when to kick in. And actually that has allowed him already in the space of about 3 or 4 weeks to progress that walking up to around about an hour. And he's enjoying the freedom of just being able to go and do it without having to think about activating these muscles. So that's one of the key things here. Muscles will activate for a task. We don't need to tell them to. You think about something like the running gait cycle. Your foot's in contact for the ground with probably less than a third of a second. You don't have the time to tell all these muscles to kick in and do their work, and you don't need to because they actually do it automatically without us needing to tell them to. In fact, muscles are so sophisticated that they kick in before the task. There's a pre-activation. And we see that if we look at EMG studies of the running gait cycle, what we see is if you look at the glutes, and we've got an EMG image here for you to look at with this. What I've highlighted, the glutes are at the bottom of this image, and there's a little area in yellow I've highlighted for you to see. Now, this is the end of the swing cycle during running. So this is just prior to the foot striking the ground. And what you can see for gluteus medius muscle in the image on the left at the bottom and gluteus maximus on the right at the bottom is this little increase in EMG activity just prior to the foot striking the ground, because these muscles kick in before they're needed. They pre-activate to stiffen the leg before the foot even strikes the ground. So we don't need to say to someone, activate your glutes. They don't need to try to consciously activate their glutes during running. They're going to kick in before they're even needed. Now, also on this EMG image, a little bit higher up on the right side, I've highlighted in blue the gastrocnemius, medial gastroc, and how active that is during the running gait cycle. Now, actually, what the bit I've highlighted for you here in blue is the propulsive part of running leading up to toe off. And what you can see here is the opposite. Actually, there's little muscle activity at this stage in the calf muscle during the running gait cycle. So not only do the muscles know when they need to kick in and they kick in advance, they know when they're not needed. And in this situation, during propulsion and toe off, the calf doesn't need to be active because we're achieving propulsion through release of elastic energy like a spring. So these muscles are incredible. They know when to kick in, they kick in before they're needed, and they know when they're not needed. We don't need to tell them. We don't need to consciously try and get them to kick in. Also, we can't say to someone by looking at the move that their muscles are inactive. Your classic example of this might be that you'd see someone with a running gait pattern where there's lots of hip drop, maybe lots of hip adduction, as we see in the image from some of Rich Willey's work. and you see someone running like this, and we say, well, I can see that your glutes are not activating during running. We can't say that. We really can't. Those glutes will be activating. We also can't conclude that those glutes are weak just by looking at the movement pattern. Now, when they find in the studies changes in activation, it tends to be that the muscle might kick in slightly later, but we're talking fractions of a second. You can't look at someone move, you can't palpate someone's muscle and say, that's not kicking in at the right time, or that's not activating. It's just not something we're equipped to do with the naked eye or our bare hands. There's also, if you look across the research, no correct order that the muscles should kick in. We can't say that the muscles have to kick in a certain way. You look at things like sort of prone hip extension might be something we'd look at saying, oh, we need to have the glutes kicking in before the hamstrings, or no, there's no evidence to support that idea that things must kick in a certain order. And if they don't, it's going to lead to pain and pathology. And again, it's very, very difficult for us with our bare hands to detect these tiny differences in muscle activation. It's just not something that we can realistically do. So that does beg the question, well, are there times where activation might be an issue? And I think part of the problem with this is it's difficult to define activation. I think we can see in the presence of pain that muscles can become inhibited. So your classic example would be you see patients after ACL surgery. They've got loads of swelling on the knee. They've got pain probably post-surgically, and the quads tend to atrophy, and we think the presence of pain and swelling inhibits the muscle, so that can lead to weakness and atrophy. But what seems to address it is strengthening it up. Get it strengthened, load it up, build it up. If you can include within some of those exercises ways that are more likely to isolate that muscle group a bit more. So, for example, our seated knee extension work we'd want to bring in at some point for our quads post-ACL reconstruction, you're going to help to work that muscle more. And it is true to some degree that we can hide weaknesses on the leg press, for example. If your quads are very weak, you can get the glutes involved a bit more. But then it's about just making sure the exercises are selected to target the weaknesses that you find that are relevant to the individual. And I think that's a great way of addressing inhibition, by loading up, by strengthening and trying to improve things in that way, but also by addressing pain and swelling. As pain and swelling settle, you're going to get less inhibition. That's going to allow you to strengthen that muscle up a little bit more. Now, if we're thinking about the role that activation might have, if we're going to use that perhaps as a way to work the muscle, and there is a little bit of evidence to support this. A nice study by Fisher et al. They did what they call glutes activation training, and they found increased corticomotor excitability, so perhaps made those glutes a little bit more ready to be worked and strengthened. But in this study, they went with long holds, a minute hold, and they did 20 reps 3 times a day, which is pretty intensive to get that kind of result. And in other studies, it does seem that we might be looking at longer hold really to get that time under tension and fire up that muscle. And I've no problem with doing this, but it's how we do it. By all means, do this pre-activity, pre-sport if you want to. Do it at the start of a rehab program if you want to, as a way of getting this muscle fired up. See if it achieves a rehab goal. Does it help someone's pain? If they do some activation work like this, do they have less pain during running or walking or a functional task? Does it change their movement pattern? I suspect it probably won't, because movement patterns seem to be a bit more specific, particularly complex ones like running. But by all means, if you want to include exercises to try and fire that muscle up a bit more, we can do that. But the issue I have is when we're trying to take that into functional tasks and telling people they need to activate certain muscles consciously or in a certain order, or they need to do certain things correctly using those muscle activations, because then I think we're going to come unstuck. And as I talked about with this gentleman, there can be a downside to that, leading people to become less confident in their ability to move, to become very guarded and tense and move in a very different way because they feel that they're doing it incorrectly. Okay, so to sum up what we've said then in this video so far, if you're doing a movement, running, walking, you don't need to try and consciously activate the muscles. They'll kick in automatically. They'll pre-activate in many cases and kick in before the task even starts. We can't really look at someone moving and say that a muscle isn't activating or that it's not activating in the correct order or the right way. We just can't really do that with people. But if you find that a muscle is weak on testing and you feel that's important for someone's pain and pathology, by all means strengthen that up, and that will often help that muscle to become more active, increase its neural drive. It might have some effects on the brain and corticomotor excitability, as we said. Great, by all means do that, but let's do it as part of a rehab program or prior to sport, rather than trying to get people overly focused on how they move and overly focused on trying to do it in a correct way with the correct muscles being active. Really, we want to have fearless, thoughtless movement as much as possible and make people feel confident in their bodies and not lead them to feel that they're not activating in the right way when they are. If they're moving, they're doing the task, those muscles will be doing what they're required. And as we've shown, they're pretty good at doing that without us needing to tell them to. Okay, thank you very much for listening to this today. I'd like to hear your comments on it. Do you disagree? Do you think there is more of a role for activation? Can you think of some clinical examples where you think it's relevant to try and do it during a task? Maybe you feel I've got this wrong. Let us know in the comments and replies. Have you come across any situations where it's been helpful, or even any downsides? Have you seen patients that have actually got worse when people have got overly focused on activation? And as I said, we've got a link to a great selection of different webinars there. We've got lower back pain in athletes, lateral hip pain, Achilles tendinopathy, iliotibial band syndrome, all free, all accessible through that link. Do go and check those out, and I look forward to speaking to you again soon. Thanks for listening. Bye for now.